episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor. Welcome, everybody, again to another episode of our show. Tonight is a unique episode. It's going to be in some ways an update to a conversation I had about a year and a half ago with the Italian neurosurgeon Dr. Sergio Canavero, founder of what is called the Heaven Project, which stands for Head Anastomosis Venture, which has been in planning to perform the world's first human head transplantation. Tonight, however, we are going to be joined by Dr. Canavero's research partner in this endeavor, Dr. Ren Xiaoping. A little background first to this conversation. And as mentioned, we're going to go a little bit beyond the cutting edge to the bleeding edge of things in this conversation. But first, a little background context. When one mentions the very science fiction-ish theme of head transplantation, or for that matter, brain transplantation, for most people, obviously this remains a topic purely of speculation and in the context and sphere of science fiction. Yet there is a very interesting history that most people are not quite aware of. Let's take a little walk through the 20th century. Back in 1908, Nobel Prize winner Alexis Carrel, a French surgeon who had developed surgical methods to connect blood vessels in the context of organ transplantation, which was very new back then, collaborated with American researcher Charles Claude Guthrie to perform the first head grafts between dogs. In 1954, Vladimir Demikhov, a Soviet surgeon who conducted important work to improve coronary bypass surgery, performed experiments in which he grafted a dog's head and dog's upper body onto that of another dog. And this effort was focused on how to provide blood flow to both the donor head and upper body. In 1965, American neurosurgeon Robert White did a series of experiments in which he attempted to graft the vascular system of isolated dog brains onto existing dogs and monitor their brain activity with EEG. And he also monitored their metabolism and showed that he could maintain high levels of brain activity and metabolism by avoiding any break in the blood supply. In 1970, he actually followed up in 4 experiments where he cut the head off a monkey and reconnected the blood vessels of another monkey's head to it. From 1970 to 1994, Dr. Paul Piche, who was professor at the School of Optometry and an adjunct professor in anatomy at Indiana University, conducted and published a long series of brain shuffling and brain transplantation experiments in regenerative organisms between salamanders and frogs and between the two. And he did quite a few experiments, published a book on that era known as Shuffle Brain. And until this day, related brain switching experiments routinely take place in the world of embryology between species such as chickens and ducks, between quails and finches. On this episode, we are going to be joined by Dr. Ren Xiaoping, orthopedic surgeon from China, who is most well known for originally being part of the first team that achieved a hand transplant, both in the United States and China. Dr. Ren attended Harbin Medical University in Harbin, China. He received his medical degree in 1984. From 1996 to 2000, he continued his education, performing research related to both anatomy and hand surgery and perfecting these processes. And during that period, specifically in January of 1999, the first hand transplant was performed on Matthew Scott, where Dr. Ren was an influential figure in that achievement. And as mentioned, he is now currently the partner with Dr. Sergio Canavero on a project to perform and plan the first human head transplantation, scientifically known as cephalosomatic anastomatosis, which is an operation that has yet to be done in humans, but which they are planning. So this is an episode that will be an update to the conversation with Dr. Canavero from about a year and a half ago. Welcome, Dr. Ren Xiaoping, to our show.
I learned medicine little bit, I think, several years earlier than Sergio. I started medical school is in 1979.
Okay.
China, this medical school, medical school is different South America, North America. It's similar to Europe, from high school to medical school. So I went to the medical school in 1979, graduated from medical school in 1984. 5 years study in medical school. Then that's me. Since 1984, I practice in clinic as resident, attending, chief surgeon, practice in the orthopedic field. As you know, the orthopedic is a very big scope. So far is spinal, trauma, tumor, hand microsurgery, so many over time private subfield. I'm really is focus is hand and microsurgery, right now, this field is hand microsurgery field is very popular so far in medical field. Most hospitals, can do that, but 40 years ago, it still is a new field in the medicine. So this field is so exciting to young surgeon. As young surgeon, I choose this field. Also, is not only my choice, is hospital. China, the system is China, hospital let me go this field. Go to special training, learning, hand fellowship. I finished my hand fellowship training in China 5 years later after graduate. Then 10 years later, I went to United States to get my international hand fellowship training in University of Louisville, Kentucky. Yeah, that's first university in United States. 5 years I stayed at university. From research fellow, hand fellow, totally finished complete my fellowship training. Also, the 5 years hand fellowship training made me today actually go this field. Currently, research, interesting, focus, clinical, even right now practice to clinic. After this 5 years fellowship training in United States, I got my first job as a junior faculty member in University of Cincinnati, Ohio. This hospital in Cincinnati, let me think about 2001. I moved to Cincinnati. Then I left Cincinnati is 2014. So that's meaning I stay in Cincinnati 30 years. 30 years. Leave the Cincinnati, also I get another is adjunct faculty member in Chicago, Loyola University. Loyola. There are 4 years. So since 2 years ago, I totally quit all the job in United States. I moved back to China. Actually, since 2012, I left United States, moved back to my hometown, China. But that time I still is both sides, China, United States. Most time I stay in China. But every year, probably 6 months, 3 months, 4 months, different every year. Go back to United States with my family union and also involve some research. 5, 6 years, this situation, that totally, right now, I totally, completely move back, return to China. Here is full-time job. Currently, I work at this university is in Guangxi, China. Guangxi, we call Guangxi traditional Chinese medicine university. Actually, this job is new one to me since that's I get the job 1 year ago. Last year I moved to Guangxi. This really is south of China. Before that, since 2012, I work in Harbin Medical University. That's my hometown in northeast of China. So far, my career background, I can think east, west, south of China. I go all well of the work. I hopefully this is my final place, final university.
Talk about before we get in, obviously, to the head related topics. Talk a little bit about your involvement with the first hand transplant in China, and talk about what things were like during that phase of your career development.
Okay. I just give you very briefly the time, the journey. I go past 30, 40 years. Now I look back. I thought since my 5 years fellowship training made me totally my career is current career. During that time in 1996 to 2000, there's almost 5 years in University of Louisville. Due to hand fellow, that university had a microsurgical center. Dr. Kleiner, he created 60 years ago, 70 years ago. He's really outstanding, famous hand surgeon. That surgeon, that center, that time, 25 years ago, going to challenges, going to do first hand transplant in the world. As you know, transplant, organ transplant, already is possible in clinic since half century ago. But organ is as option in clinic to patient treat heart, kidney, liver, every medical problem. But hand surgery still cannot do hand transplant. Hand transplant, why? The hand is special organ. This organ is, we call also is one of the field is composite tissue. Allo composite tissue. That means include all the body tissues, not like organ like heart cell, liver cell, hand, skin, bone, vessels, muscle, particularly skin. Skin is high, strongly reactive if graft. So that time immunosuppressive cannot be controlled, prevent rejection after surgery. So hand transplant, composite tissue is delayed, is postponed later 30 years at least. Come to clinic, learn organ transplantation. So I moved to United States. That center going to the first hand transplant. That means have to overcome, have to find a good way to salute, prevent rejection after surgery. Technique, no problem. Hand surgeon, China, United States, global. Hand surgeon all can do this kind of surgery. But we need, before the clinical, doing some research, preclinical study to guide the protocol, immunosuppressive protocol. So I'm pretty lucky. 25 years ago, when I went to the United States, I joined this community, hand transplant community in the center as a first fellow. So we That's interesting. Actually, before I went to there, this center already initiate this project, get funding, want to do first-hand transplant. However, the problem took half years, at least maybe 1 year, in the lab to develop this model, preclinical model, using the pig, but fail. That's why technique no problem, but the pig, if you want to do the pig hand transplant using the drug control, the rejection, have to make this animal, the pig, survival after surgery 6 months.
Mm-hmm.
However, the pig is a human.
Sure.
After surgery, we transplant them. The pig, after wake up from anesthesia, is moving, walking. Immediately, whatever strongly internal fixation, the limb broke again. So we have to sacrifice the animals. Cannot put animal long-term survival. So the project is still not going, cannot move. So I was there. I doing some revolution. No, not a revolution. I doing some change, make a new model, solve this problem. So we get the immunosuppression protocol we develop. That is gold standing protocol. Even right now, the global using this protocol. So that's meaning made clinical hand transplantation from basic science study is possible. So after 2 years, I come to United States. This center doing the first hand transplant, successful first one in United States. Also is successful first successful one in the global. So hand became to clinical option to patients. So that's meaning composite allotransplantation is possible in clinical. So after first hand transplant, first phase transplant, success, phase transplant. After phase transplant, first all the composite organ come to clinical. However, only one is still not. That's meaning head. We can call head transplant. Head transplant is not a new topic.
Sure.
This is always already in clinical. In the research field, testing over 100 years. First scientists tested in United States, in Chicago. But technique problem, immunosuppression problem, also have an ethical problem, made this project is stopped. Dr. White problem in her, Robert White.
Sure. Yeah, you mentioned obviously this history, and it goes back to Robert White, and even before that, you can go to some of the Soviet experiments with dogs, but even recently, if you look at one of the things I've always been interested in, and it's not head transplantation, but it's brain transplantation, that you had Paul Piche out at University of Indiana with frogs and salamanders and interchanging brains between those species back in the 70s. So the concept of brain shuffling has been around for a while. So yeah, I agree with you there. How did you, obviously, as we mentioned before the show, I've met with Sergio about 1.5 years ago. How did you and Sergio Canavero first get together? And what was the first discussions on this topic about? Was it sitting around having lunch and decide, what, we should do something here? What was it all about? How was that first meeting?
Okay, I go back to follow you this week. Since 2012, I returned to China, my hometown, Harvard Medical University. I started testing, exploring head transplant. I developed the animal model from smaller animal, mice, dog, monkey. Couple years later, this model we can say stage result we got is pretty good, exciting. So I published these my research result in the academic journal.
Mm-hmm.
Then one day I received an email a surgeon sent to me asking me, "Wow, Dr. Ren, I know you are interested in study this project. I am interested too. Can we keep contact, communicate,
Mm-hmm.
exchange some research information?" So that time we meet by the email together. We talk. That's 2014 or 2007, probably 2014. Okay, we keep talk, exchange some information. This field also is his interest.
Mm-hmm.
And also I continuous practice, testing this research in my lab, in my team. In 2014, on the May, United States, in Maryland, had this meeting, orthopedic and the neurology meeting, held in Maryland, May. So during the meeting, we both invited as speaker. So we meet together. We all give present from our both research field, talk about this idea, talk about the technique, talk about the goal, talk about in the future, and even we designed how is clinical translate. So that is we first time meet together. 4 months later, in China hold a international academic meeting. So I invite Sergio to China. We both talk about in the international meeting. So we more close collaborate together. And also due to this couple time to meet together, we think about heart transplant from technique actually is possible. No more problem. The most challenging issue is spinal cord injury.
Mm-hmm.
How to make spinal cord functional recovery. So we spent 1 week surgery in my office. He didn't go anywhere. We used 1 week. We are detailed to make this proposal. Next stage, how we to do. So this is 2015. So since that time, we in my team, in my laboratory, we start more focus this spinal cord injury.
Mm-hmm.
That's what we call Gemini protocol, spinal cord fusion technique.
Mm-hmm.
We testing animals from mice, rat, dog, monkey. So we are so lucky. We quickly got all what we need result. Pretty good. This idea is possible. Spinal cord fusion is possible clinical is good way to salute this medical problem. So since last year, I moved to this Nanning, Guangxi, Nanning, current this university. I do this clinical translation.
Mm-hmm.
Translation. We are testing this idea in clinic. Right now, actually, we still is testing. First clinical trial in the global here, we initiate. We are currently is doing. So that is surgery. And also last year, in this university, we hold is an international meeting in Guangxi. Sergio was invited again to this meeting, give a talk. And we right now more and more focus clinical translation from basic science. We want to make this new idea as soon as possible to clinic, to service patients, to make 1,000 patients, paralysis patients stand up again. And our result give us is possible. It will be soon we get the final result.
And as far as the, I know you've done a lot of experiments. You've published with a lot of the mouse work and some of the other animals. How is obviously and I'm speaking from obviously a United States perspective here, but obviously the riskier work gets, the more difficult it is to get funding. How is the sort of science funding scene in China or elsewhere that you're discussing in 2020 looking for projects like this? Or I don't remember the sort of the numbers that Sergio originally was talking about in terms of what it would take to do a full clinical intervention for one patient. But have you found? I mean, obviously it's been very difficult with the pandemic and everything. But have you found sort of the scientific funding interests loosening up for this, or is it still kind of too futuristic for a lot of people?
Okay. As common sense, doing research, you have to have funding. Without funding, you cannot do everything.
Sure.
So every year, I must apply, submit my research project to get funding, to look for funding from the national, from the local, from the hospital, from university, every way. I not get too much funding, but current funding is enough to support my research going and the clinical translation. Of course, I hope I can get big funding, but that's the part. I'm still in struggle to look for funding. The project, if spinal cord injury can be solved, that means paralysis patient can stand up. Head transplant should be quickly, should be soon to clinical transplant. I know this project, so many people in the global, even in United States, many medical doctors research interest in this project, try to move up this project. Everybody is from their own research team live to get idea, to improve the technology, everything instrument to make this project is possible going. Well, I think this will be soon because the patient required is doctor is interested. 100 years ago, doctor is interested. Current doctor still is interested. I have so many collaborators, famous doctor in China, in United States. They are all big guys. They are think about is struggle, is working this project. But the key, the critical technique is spinal cord fusion. If spinal fusion technique salute, no problem. I think go to clinic should be soon. China don't do that. America should do. America don't do that. France, Germany, Europe. The global should be so many different research clinical team will be moved quickly to translate.
And future visions, ideas. Obviously, you've done a lot of the animal work. As you just mentioned about the funding. Are you and Sergio still thinking that China is going to be the place to do this, or are you looking at other locations? Are there other that you could talk about, other clinical partners that maybe you getting involved, that if it has to go to Brazil or other areas in Southeast Asia, any other interesting locations that may be more flexible than either, say, the United States or China?
Right now, hard to say, but so many places interesting. That's depend the mutual. If the technique mutual and the politics, and of course depend the institute, what interesting, what which institute would like to do the first. Maybe first one in United States, maybe in your hometown, maybe in my hometown, Ohio, maybe in Harbin, maybe in Guangxi, I don't know. Depend, everything depend. I think it should be soon.
Well, I really appreciate this update. It's as I mentioned before we talked, it's always interesting listening to the history of it, and that in the area of the biosciences, which is always very slow moving, it's always fascinating to hear about projects that are on more of the bleeding edge than others. And wishing you and Sergio the best with it, and you continue, and that ultimately there'll be enough funding for clinical translation soon, because this is like anything in the sciences, as you were mentioning, this has been going on for the last 100 years, whether it be on dogs or monkeys or what have you. But at some point, this is going to happen. So, thank you for you and Sergio leading the way on it. For everybody that's going to be listening to this episode or watching, Dr. Ren Xiaoping, orthopedic surgeon, first-hand transplant in China, working with Sergio Canavero on potentially the first cephalosomatic anastomosis project, which means the first human head transplant. Dr. Ren, anything else you want to talk about while we have you today that we didn't touch on?
Sorry, say again. I didn't catch up.
I was just going to give you the microphone again to, if there was any other areas that you wanted to mention about the project or anything else that you wanted to talk about related to it. I was just going to give you the floor to talk for any more longer that you want to.
No, currently is not ready to talk. Okay, maybe later.
That's fine. We'll come back and do another episode. Not a problem, because this is an important theme. But thank you for taking the time. I know it's early in the morning there, but appreciate you talking. And wishing you the best for it. And I hope, like a lot of the science which has been stalled in the last year or so, that this will keep moving forward as well. But
okay, thank you very much for your interview with me.